NDAND strives to improve the nation's health and advance dietetics through research, education, and advocacy.
Well done, Veronica. Their president, Jennifer Haugen, along with symposium chair Deborah Strand, joined us this morning to talk about their upcoming symposium. Leslie, thanks for being here.
Yeah, thank you.
So what does NDAND
stand for?
Yes.
It stands for the North Dakota Academy of Nutrition and Dietetics. So we are an affiliate of our national association, so right here in North Dakota.
Nice.
Yeah.
And so what do you guys do, and how did it all get started?
So we are here to promote health as dietitians. Dietitians work in many different areas in health. The standard, you would think, work in hospitals or clinics, but we're also in health and fitness centers, in food service, schools, and just for promoting health promotion.
Great. I was just going to say the symposium that we're having tomorrow, will be at this Holiday Inn, is actually to help our members in advancing their continuing education. This is one thing that's very important to us, that we're always kept current and accurate with the nutrition information, and we're passing that on to our consumers.
So how big is this community then? I mean, who will attend the symposium?
Well, currently on the North Dakota Academy of Nutrition Dietetics, we have over 400 members. And in the past, we typically have had just dietitians attending our annual conference, is what we called it. But just recently, we changed it to Nutrition Symposium, and our theme is Nourishing Health. And with the Nutrition Symposium, we're actually opening it up to other allied health professionals. So we have physician assistants attending, certified dietary managers, dietitians, of course, students, nurses. So it's actually bringing all of the health professionals together and learning together about current and accurate nutrition information.
So what are they going to learn tomorrow specifically? I mean, is there some new cutting-edge stuff that you're going to be talking about? Or?
Well, we have some very, very exciting and interesting speakers, and our focus was to hold a conference and just focus on our North Dakota either educated experts in nutrition or those that are working in North Dakota. So our topics are on eating disorders, oncology nutrition, which is cancer nutrition, also some current information and research on our the dietary guidelines for America. And then we also have a topic specifically for dietitians that are helping us with knowledge on reimbursement, because many of our disease states can be reimbursed by insurance, and so we're updating ourselves on that and helping our consumers, again, having dietitians as their source of information and also having insurance reimbursement.
So as you're out there working with people, like what's the biggest, I don't want to say myth, but like what's the thing that maybe we're ingesting the most that we shouldn't be, and what should we be ingesting more of?
Yeah, I can take that. A lot of times when folks think of a dietitian, they think it might be scary, or think that I'm going to a dietitian, they're going to take away my favorite foods. And I like to tell, when I work with my patients, that it's not about taking it away. It's figuring out new ways to incorporate your favorite foods, and then learn ways of incorporating fruits and vegetables and how to make it tasty and something that can be sustainable lifelong.
And when we talk about the numbers for obesity and then the diseases related to that, that's just a growing concern. I would imagine that your field is in demand right now and growing.
Yes, prevention. I work in the area of prevention and weight management for All True Health System, and we are going into more of the preventative health and how can we prevent those disease states, cancer, diabetes. So I think it's a growing field. I think it's maybe not thought of because we think of disease states, but if we can focus more on prevention in the upcoming years and preventing those diseases, we can not only save money, but we can save folks from developing those diseases as well. So through good nutrition, exercise, and just healthy lifestyle in general.
Do you have like one superfood that we should be eating more of?
Oh man. You know, I just usually say there's not specifically one, but try get good variety and eat a rainbow of foods. So don't just focus on, like, we think if you're going on a diet, chicken or salads. Well, there's a lot of different things available out there, and you should get good variety because there's maybe nutrients that you would be missing.
Okay. I always say that Good nutrition is only good nutrition until it's unless it's eaten. So you want to make sure that what you're eating is the foods that you like, but also, as dietitians, we often say you can have your cake and eat it too, but don't eat the whole cake.
Right. I like that. Okay,
like
quickly
that.
before you go, one more time. The Nourishing Health Symposium is tomorrow.
Right.
Yes.
At the Holiday Inn, and we're having probably about 140 attending, which we're really excited about that.
Thank you so much for coming in today.
Thank you.
Stay with us. Coming up next, we're going to tell you how you can sign up as a volunteer for this upcoming flood season.